So just a few housekeeping items as we start. We are recording this session and also in the recording and the deck and additional collateral afterwards. Hopefully all of you would have already received your Uber Eats gift card and voucher, but if not, feel free to ping me or I can put my email in the chat and email me on the side and I'll help to resend that for you. Very excited to introduce and have Klara host this Lunch and Learn. They're a longstanding, highly adopted and great partner. I'll turn it over to them shortly to introduce themselves. This is definitely designed to be interactive, so feel free to ask questions throughout, whether that's through the chat or unmuting yourself and asking live. And with that, I will turn it over to the Klara team.
Thank you so much. So I'm Francesca Belmer. I'm our Director of Product Marketing here at Klara. I've been with the company for almost 2 years now, and I'm very excited to do this Lunch and Learn. Usually we've done webinars, they're a little more formal, but I'm really excited for you all to interact with us. Ask questions in the chat, unmute yourselves, turn on your videos, ask questions live. We really do want this to be more of a conversation. My associate, Erica Patitucci, is going to be joining shortly. And if you have any of those in-depth, deep technical questions as we're going through, once she's on the line, she'll be able to answer those for you live, which is very exciting. And then, Fran, I will go ahead and let you introduce yourself.
Hi, I'm Fran Saperstein. I have been a customer of Klara since December of 2018 and joined Athena about a year ago. And so I'm excited to share my journey.
Awesome, thank you. All right, so some legalese speak that we'll just put on the screen for just a second here, since it's being recorded. But really, the bulk of today, we're going to be talking about the current state of the industry and the challenges that I'm sure you're all facing. It's what we hear about every day. How we're trying alongside Athena, to make healthcare a little more accessible for all patients that are in their healthcare journey, which we're all patients at the end of the day, and then really how to unlock that efficient patient engagement using Klara with Athena through patient communication, through team collaboration, and hopefully through workflow automation and really automating a lot of those outreach points. And then we'll definitely have a Q&A at the end. But like I said, if you have questions in real time, please don't hesitate to ask. So we will start first with a poll. And Allison, maybe let me know if that poll is live. I can't really see it on my screen, but please, by all means, you can all answer in the chat to let us know kind of where you're at and how you think your practice understands, how you're meeting your patients' communication preferences today.
I'm adding that in right now. Give me one moment.
Awesome. And then while Allison's doing that, I'll go ahead and talk to our next slide and kind of get things kicked off. But that poll will be presented right there in the chat for you guys to interact with, so we can kind of capture and engage where you're at today. But we'll kick it off. So challenges that we're hearing that many practices are facing today and have been for a while. One of the biggest things that we always hear about, and it's really why Klara exists in the first place, is that patient communication and their communication with practices is the majority of the issues or frustrations that they experience along their healthcare journey. It's not about the care. The care is great, but that communication, the back and forth and waiting on hold, it's kind of a pain point. And I'm sure you're all very, very aware of that. So, even prior to the pandemic, we were seeing an increase in burnout that happens with our medical staff that, we are so fond of. And so now it's nearly 2/3, post-pandemic that are nationwide, doctors, medical staff, nurses, front desk staff that are really feeling that burnout. So Fran, I just wanted to kind of ask you, how did the pandemic impact your practice staff and your operations overall?
Yeah, so pretty much about the time the pandemic was hitting, there was, the obvious panic. And we had a few people quit because they didn't want to be exposed with patients, even though we put all precautions in place. So we actually lost our front office staff. So we lost our person who was supposed to answer the phones. We lost a person who was supposed to check patients in, which presented, of course, a nice challenge at an already challenging time. But luckily we had Klara in place. And so we were able to reorganize the way we did things to utilize Klara's automations and Klara's templates. And then during the pandemic, Klara smartly added in video, which really helped us because we had been using DoxyMe because it was part of their free option for people. And we were having less than decent success with it. So we were very happy to switch over to our partner, Klara, and have not turned back. It's been fabulous. And it continues to be a big part of our practice, even though telehealth is not necessarily as reimbursable as in the past. We're a direct pay practice, so that doesn't affect us.
Awesome. Thank you. Thank you for sharing your insights. And that's actually a great segue into how we can use technology today, to solve some of these problems. So, maybe this image will resonate with you all, but, throughout the healthcare journey, there's a lot of communication with multiple parties, both inside and outside the practice. Sometimes there are parents, that are guardians of children. They're talking to specialists. They're relaying information back to the doctors, and then they're trying to get checked in, and maybe they need a prescription. They're talking to pharmacies, and it can be a lot. There can be a lot of back and forth. There's that game of phone tag that constantly plays. And, I would say 90% of patients place importance on their practices using the latest technology, which is kind of a staggering number. That was even a surprise to me. So what Klara is trying to do, and hopefully we're doing it well, is centralizing, that entire communication kind of mess that you just saw, and really streamlining it into this process. It's kind of more of a one-to-one. You don't have to search all over the place to get the information that you need as a patient or as a provider. So Fran, in your past experience, because I know you started your current practice with Klara, but in your past experience, what challenges have your practice faced around patient communication, and then why did you ultimately choose Klara?
Yeah, so we came from a larger practice of 7 providers and about 35 staff. And even with that number of staff, we were not able to keep up with the phone calls. And we had consistent patient complaints. Patients were not being called back if they called. They were on hold for a long time. They weren't getting to the right person. Each person gave them a different answer, depending upon which department they were and whether that was their regular role or not. We had a lot of issues. So we went into our practice knowing that communication was going to be the number one issue, especially because we deal with complex chronic patients. And so our patients, just like any neurology practice and any practice, but especially with neurology and specialties, when you've got patients who are chronically ill, they constantly need to interact with their providers. And just like in primary care, which I managed years ago, it's very important to be able to have access to the medical clinical staff and the administrative staff so that the patient can easily find out what's going on, whether it's with prescriptions or referrals or, gosh, anything, even knowing what time their appointment is if they haven't written it down.
That's so true. And we'll actually, later in the presentation, we'll walk you through some of Klara's process as well of how we kind of interjected all of those touch points. But for now, by connecting Klara, and especially with one of our favorite partners, athenahealth, your practice can unlock that efficiency. So again, really streamlining that patient communication, having your internal teams within the practice collaborate a little bit better and a little more seamlessly. And then again, we'll get into the workflow automation piece. So all of those automated touch points throughout the entire patient journey, we're gonna kind of show you how we tackle those as well. So one of the biggest things that we hear, especially if you're, you're an admin, you're that front desk staff, you're trying to check patients in, it's really hard when the phones are ringing off the hook constantly. And, sometimes that takes away from the actual patient care or the patient right in front of you. So, throughout Klara, we try to make sure that patients can reach you through whatever communication channel that they prefer. So, if you have, a call to text integration, that's our phone integration. Basically, we fit into your phone system and phone tree that you already have in place. And basically, I call in as a patient, I'm waiting on hold maybe for 10 seconds. Well, I'm immediately prompted that I can press 1 if I want to, and instead of waiting on hold, I can receive a text message, and I can start texting with my practice that way instead. So we actually have an 89% utilization rate of when our patients are prompted with this call to text feature, they choose to text with the practice instead of actually staying on hold. Now, they can, text and initiate those text conversations on their own if they'd like. And then we also have a website messenger. So our web messenger goes right on your website. It's a little chat bot. We're all very familiar with them at this point. And they can, talk directly that way. It's basically like a mini Klara interface right on a practice website. So it's a very seamless patient experience. They kind of have the same interface that they're interacting with every step of the way. And then voicemail. We have, some patient populations prefer to stay on hold, prefer to talk to someone live, and maybe, they're on hold for a while, so they get a voicemail instead. Well, when they leave that with Klara, we transcribe all of those voicemails for you. And then it kind of allows people, like providers, practice staff, instead of having to listen to that entire voicemail, maybe 2-3 times because they're getting interrupted, with other phone calls or patients that are walking in, you can just select the key points of information within that transcription and, catch the important information that maybe you've missed, maybe on the actual, recording, the patient was mumbling a bit. I know I mumble a bit. So this is probably pretty often that this happens, and maybe you missed the date of birth. Well, now you can just go in and you can see the date of birth, and if you want to double verify, you can click it and it'll play right from that point for you. So it's saving a lot of time instead of, having to listen to these, 2-3 minute long voicemails multiple times. And then email. Email is a one-way push for us at this point, but we do send email reminders to patients just to make sure we're covering all the bases so that they're always engaged, again, via whatever channel. The other thing, that's kind of what I was saying, the voicemail here, we learned that, sometimes we want to make our system smarter and more efficient for you all. So we've introduced some AI, very hot topic right now, AI and machine learning models that can basically read these voicemails and identify what the message is about. So, when we get into talking about routing in a little bit, to make sure that those messages go to the right provider or staff member in your practice, our system can identify, based on all of the context in here, is this related to scheduling? Yes, and it automatically routes it off to maybe your scheduling inbox, whatever you have configured with Klara. So it's a pretty cool feature. And we did that by surveying all of our members, all of our customers in the Klara family, to make sure that it was, more intelligent, than even maybe perhaps what the patient selected as the reason that they're calling in or texting in. So it's pretty cool. It's got a 95% accuracy rate at this point, highly accurate. We're all patients and busy throughout the day. The patient accuracy rate for when they select, a reason why they're reaching out, it's actually only 80%. Because we're all multitasking and just kind of like hitting buttons here and there. So this is a thing that our customers have really enjoyed. One of the things that we kick off is scheduling. So this is huge, right? It's usually one of those first touch points throughout the patient journey. And now we have a nice scheduling tool with Athena that they can pick their time. It auto books on the calendar, and then we make sure that in that scheduling flow, or maybe directly right after, we automatically send out a text message saying, hey, let's collect all of your digital paperwork. So instead of a large stack of paperwork that you have that patients are filling out, they have to come in 30 minutes early for, now they can just do all of that from their phone, from their computer, on the go, wherever they're at. And Fran, I know that you guys use forms through Klara. Can you tell us a little bit about your experience of collecting those?
Yeah, so especially when the pandemic hit, but even before that, because we are a highly specialized practice, we needed a way to screen our patients. And we had been using PDFs that we uploaded to Klara, and then Klara put in place forms, and we were able to create fillable forms. So those PDFs could turn into fillable forms, or we could create forms on the fly, which is my favorite way to do it. I find that much easier. And they're easy to update. And so our patients get screening requests. We can request a copy of their insurance card. We can request a copy of their photo ID. We can keep track of which forms they've completed versus those that they haven't. what we did find is instead of doing one long intake, we had to break it into a few different pieces. It was just easier on the patient. It's a little scary to them to see a bunch of different forms, but I let them know when I speak with them that those are going to be short forms. And so that's been really helpful for us. It's really changed our practice a lot. It's a great way for us to not miss anything in advance, make sure that as new needs come up, we can add to that without a lot of stress, without a lot of steps, something I don't need to go to my rep for, I can do it myself. And that has been very freeing to be able to have control over that.
Awesome. What would you say the impact of that is for your practice, in terms of, if you could say off the top of your head, maybe like a time savings or something like that?
Yeah, so we would, first of all, money, we would have to get forms printed. And, printing paper, they're not inexpensive and they take up a lot of space in the office. And then they have to be collated and you have to make sure that the patient gets them. So we needed a staff member just to put them together and hand them out to patients or mail them. So we saved in mailing. And, it goes on and on. Now everything is digital. I can access it. I can easily add it to Athena by clicking a couple of buttons, and it makes my workflow is so much easier. I haven't had to replace those 2 staff I lost.
Oh, that's wonderful. I'm glad that you guys are working so efficiently. I'm happy to be a part of that as well. All right. So another thing that we want to get into is the team collaboration part, right? So this is huge. And I think that this is one of those things, like when we talk about Klara and we talk about any kind of patient engagement or patient communication tool, this is one of those things that's a little lost in terms of like the value that you can really find with our software. And that is that, again, no matter how the patient reaches out, whether it's through the web messenger, that texting, the call to text feature, or leaving a voicemail, or, just being on the phone, it's all centralized within this interface. So, patients aren't texting your phone specifically. They're texting this practice textable phone number that we provide them, and all of it lands within this nice little interface within Klara. So you have this patient thread that, all of the context from the past 7 years is located in there. You can see upcoming appointments that maybe they have scheduled. You can see the past appointments they have scheduled. You can also see all the forms that are either completed recently or still in progress. Maybe they're outstanding. So you might want to give, a patient a nudge that they haven't completed that form just yet. But the other cool thing about the team collaboration is that you can also have multiple parties within a patient conversation. So, maybe it's initially the front desk and the patient that are communicating, but then, instead of having to go play phone tag internally and have your billing person, get information for you that then you relay onto the patient and vice versa. And it's this little kind of game of what is that? Like, I think phone tree game, back and forth telephone.
Yeah.
Now you can just kind of add that billing person into the conversation, and now you have a 3-way conversation and get that time to response decreased overall, and make sure that patient gets the information that they need when they need it. So that's one of the cool things. The other cool thing is our routing feature. So like I said, occasionally we have some AI routing that automatically identifies the message reason and completely assigns it to the right shared inbox that your staff might have set up. Or we just have some configured routing that, if a patient specifies they're reaching out about scheduling, that message will automatically be routed to that scheduling inbox. And that inbox can be, something that multiple staff members are subscribed to make sure that those messages are getting responded to in a timely manner. It's a pretty cool feature. It really cuts down again on that response time to the patient. There's less manual triaging between, say like the front desk who's on the phone, and assigning it off to certain staff members. Now it just happens automatically, and it really is a decent time savings for everyone. The other thing, it's kind of an example of the interface of what some of these shared inboxes look like. So you can see, let's say I'm working the front desk and I'm a part of a lot of different, conversation inboxes, what we call them. Well, my inbox, what this screen is, kind of like your home screen and within Klara, it's going to show me all of the messages that I have or that I'm a part of, that I'm, other inboxes that I'm subscribed to. So you can see like the first example is, the inbox from the billing team, but I have access to it right from my interface. Another one is, like an inbox for the nursing staff, but I'm also subscribed to that inbox, so I can kind of field and help with all of these inquiries that come in. And then one of the cool things, I'll show you right down here, the one that's highlighted in yellow, you can kind of mention people, right? So kind of like, like if you're on Instagram or Facebook or Twitter and you can somebody and, like call them out or have a conversation with them, you can do the same thing within Klara. So it's invisible to the patient, but let's say you want to have some internal team collaboration. And, because of that, you don't want the patient to be necessarily, like seeing the internal conversation, but I can mention, like, at Dr. Belmer, this is the question the patient had, can you provide some guidance? And then he'll see that, he'll respond internally, and then that person that's responding to the patient themselves actually can kind of copy and paste and relay that information. So it's a nice little internal collaboration thing. Now, Fran, can you give examples of how your practice uses Klara to kind of streamline that patient communication and that productivity?
Yeah, so first of all, we love the routing. The routing has been a lifesaver because when we first started Klara, that did not exist. The AI just hadn't been there yet. And so I would spend the majority of my time figuring out who needed which message. So that was a godsend. And it works really well. I still look at the triage box for things that don't fit, but don't fit in any specific one, or they've asked a bunch of questions and confused the AI. But for the most part, it has saved me at least 3 hours a day. Seriously.
Oh, that's wonderful.
And then using the app function and collaborating within Klara has been incredibly helpful, especially when you get new patients or you make a change to a procedure or pricing or insurance changes. All of those things can be done sort of behind the scenes, but within the account so you can keep track of it. So it's a really great way for us for like the medical assistant to say to me, hey, when do we collect blah, or when do I need to get this, and confirm that they have what they need. And it's a quick and easy way for me to respond. Even if I'm on the phone with somebody else or answering another question, I can jump in there and quickly respond correct, or no, come see me, we need to figure this out, or whatever it is. That at function, we just love it. We love using that internal communication. It is our primary. We also use Microsoft Teams, but when it comes to patient-specific things, we're using it in Klara because then it's connected to the clinical.
Oh, that's perfect. And you touched on a great point too, of just, while you're on the phone, you can respond, to a message within Klara. That's something I should have touched on earlier. It's, you can only get so many phone calls into your practice, right? But what with Klara and with the messaging capability, what once used to be, one phone call for 3 minutes, for 10 minutes, and that's all you were doing. Now you can respond to multiple patients, all at the same time, because you can go to one, look at the chat history and be like, okay, this is the information they need. And then go to the other one, right? And, multitask back and forth. And so your ability to scale the number of patients that you can service is just, infinite.
Yes.
Awesome.
So Francesca,
and then,
we actually have a question in the chat that I'd love to read to you.
Lovely.
So how are you restricting patient scheduling based on body part, insurance, and MD preferences?
Let's see here. Do we have Erica on the call by chance? Yeah. Okay. Let me save that question to the end, if you don't mind, because I don't want to give you any incorrect information. I'm a little more on the marketing side, and my associate that's going to join in a few minutes here, she's on the highly technical side, so she will definitely have an answer for you. Okay. All right. So we will definitely make a note of that. Not sure who asked, but don't worry, we will get back to it. And then one of the other things, going back to kind of that team collaboration, Fran, do you guys have experience using kind of that collaborating with outside of the practice, with third parties, with pharmacies? Does your staff use that at all?
So we've had it with other physicians, and we've actually, our neighbor upstairs started using Klara and came down and asked me for some tips. So we sometimes use it with them, but for the most part, that is not something that's been well integrated in our market.
Okay.
with the local pharmacies, and mostly they're retail pharmacies, or they're like the large Optum or
Yes.
Caremark. And so they're not using that as much. For the most part, those are phone calls that they're still making. Pharmacies are still very analog, and that's the majority of our of our intake of phone calls from providers.
Okay. That's, I mean, that's unfortunate that they're still a little bit analog. But
Yeah.
what some of the smaller pharmacies that we do have in our Klara network, a lot of our customers can go ahead and add the pharmacist to the conversation as well. So it's not just adding, people within your own staff, but you can add a pharmacist into the conversation with the patient, and it takes that entire, for example, prior authorization workflow that can take, just hours across days to go back and forth with insurance and the pharmacist and the provider and the patients calling for statuses. All of that now can be centralized within Klara to make sure that, the authorization paperwork is there, it's sent within the thread, the patient thread, the pharmacist and the patient can talk directly. You as a provider have visibility to that entire workflow and that conversation. And then, the pharmacist can actually then text, message the patient and say, your prescription's ready, you can pick it up at this time. And that really just, again, closes that gap significantly. So another exciting way to collaborate both externally and then also internally as well. All right. So are there any other questions that have come in, or just the one so far? Just the one? Okay. We'll keep going.
Looks like someone has their hand raised, though. It looks like there might be a hand raiser here.
Okay.
Yeah. Hi, this is Leanne Galligan with Peachtree Orthopedics. For some reason, I'm not able to post anything in the chat. I don't know if that's a setting thing. It says I'm not a member of the chat. Your transcripts, do those automatically interface with Athena to be saved? Can they be saved, like printed to a PDF to be uploaded to the chart?
So we're actually going to get to that in just a second here, so I can actually show you a visual of that. But you can basically, with one click, save any of those messages, any kind of important context that you might need, and have that exported into Athena directly. And then from a more technical perspective, again, once my associate joins, she can actually tell you exactly where those messages go, how they're saved. I do believe it's a PDF, but don't quote me on that. Yes, okay, excellent. Thank you, Fran. Wonderful.
Yeah, we use that a lot.
Perfect. Oh, well, would you like to talk about, that process, maybe what you like about it? What could be improved? We want to be very honest.
Okay, yeah. So you can choose just parts of a conversation. So if you just want to look at there's one conversation between the provider and the patient, or even a staff member and the patient that you want to make sure ends up in the chart because it leads to some sort of a clinical change or something, you can easily just click some buttons. It's like choosing radio buttons in a questionnaire, and then click a button that says export. And it will automatically export it to documents, and you get to choose where you put that, and it'll go as a PDF. I usually choose clinical document because that's usually where it goes, and it ends up as a document there, and you can easily find it. It's almost immediate that it gets into Athena.
Awesome. Thank you. Thank you for covering that.
Mm-hmm.
Perfect. All right. And then, so like we were touching on earlier, Klara really does try to be there throughout every single step of that patient journey. And all of these touch points that, used to require some kind of manual outreach. Well, now you can automate pretty much all of these touch points and make the messages very personalized and customized, based on the appointment type, maybe the location or the provider, so that your patient feels like it's, not just an automated message that they're receiving, that it is really more of that conversational feel. And that's what we strive for. One of the examples of that is our appointment reminders. So, you can always customize these to drop in, obviously, your practice name, the date of the appointment, the time of the appointment, maybe if there's a location, you can drop that in. And then when they go ahead and confirm, you can customize this entire follow-up message. So maybe your building, your practice building is located in, kind of a hard place to find. You could customize that follow-up message to provide a little more additional details of, hey, Google Maps is going to tell you to go here, but actually you're going to want to turn on 3rd Street instead because that's the better parking lot. So you can really make it so that it's really easy for that patient to find you even, in person. So that's a good example of an appointment reminder. Re-engaging patients because, again, we're all patients. We get really busy. Sometimes we miss our appointments, and as a practice, that's a loss of revenue for you all. So instead of, just kind of letting that patient, fall to the wayside, now you can automate if that appointment is missed, that you immediately re-engage them, maybe like the day after you automatically have a message sent out, like, we're so sorry you missed your appointment. Like, let us know if you'd like to reschedule, and then you can go ahead and get them to rebook that appointment and get back on the calendar. Another great thing, and this is really a really important one, and I want to talk it up as much as possible because there's a pre-visit and a post-visit automation that we can set up for your practice. And what it does is basically pulls in what used to be, that stack of paperwork that you're like, hey, here's a bunch of paperwork. Here's what you need to prepare for your appointment with, don't eat this, do drink water. Well, now, instead of, patients losing that paperwork or you even having to deal with that paperwork to begin with, and they're not calling in anymore because it's all in their phone. They get that text message and they can, click a link in there and see all of the instructions that they need to prepare with. And it's always right there. They're, unless they lose their phone, then hopefully they have their computer. So it's never lost. It's all digital. It's all in the palm of their hand. One of my favorite features, and Fran, I'd love your feedback on this, but we have a Chrome extension. So it's really hard if, especially if you're only on one monitor, and we all are at some point for one reason or another. It's really difficult to, just multitask and switch back and forth between these browser windows constantly. Well, we don't want you to have to do that. So Klara has a Chrome extension that you can, enable in your browser. And then you can see right on top of your EHR interface, right on top of Athena, you can see all of Klara and access, those patient details, the conversation, and kind of multitask at the same time if you need to do anything, on the clinical side of things. So, Fran, do you guys use the Chrome extension? And if you do, what are your thoughts?
So we used it in the past, but most of my staff have 2 monitors now, so we just had to go there. So for the most part, we don't use it very often, but when I'm home, like today, working from home, I do use it, and I find that it does a lot of the same things. Because it's smaller, it's a little limited on. I can't get to all the full list of all the documents that are uploaded, which I can get to on the full program. And so I often am going back and forth. I always have a second tab open. But for quick communication while I'm doing something else, or I'm trying to answer a question about a patient, looking that patient up on Athena and trying to get the order to be able to explain it to them, it is fabulous for that.
Oh, wonderful. Well, yes, I know this is one of those things that, it seems like a small feature, a small enhancement, but a lot of our customers just absolutely love the ability to see everything within one screen. So again, we're just always trying to increase that convenience overall. But we've kind of come to the end of our presentation. I know we have a couple of questions. So if there are any more, I will do my best to answer those. Let's see. Do we have any? All right. Okay. So I see the one from Kevin, thank you, about how we're restricting patient scheduling based on body part insurance and MD preferences. Kevin, I apologize. I am going to have to wait on that question specifically. If my associate's not able to join, that I will definitely make sure that we follow up with you individually to get that question answered and have somebody reach out. Shannon, I see a question from you. If the patient picks cancel, would it automatically cancel the appointment in Athena? I believe it does automatically cancel the appointment in Athena. I think there's also an option that you can have as a queue, so you can manually approve that cancel if you'd like. But if you have any other questions on that, Shannon, go ahead and either unmute yourself and then we can chat about it, or you can type it right there in the chat. I see Allison put a poll up. So that's exciting. So if you don't have your chat little window open, if you like kind of move your cursor over the screen, a little toolbar should pop up, and there's a chat bubble that you can click on, and you can go ahead and be more interactive with the poll. Let's see here. Just asking if anybody would like, us to reach out with a personalized demo. These demos can be either very short or, as long as you need. That's actually where Erica is at right now. She's on a demo with a customer that's running over. So yeah, we can condense something down to like 15 minutes for you, because we don't want to, take too much of anyone's time, or, we can be very in depth and, do 30 minutes, 45 minutes, an hour, whatever you guys are interested in learning about. Any other questions about Klara specifically, about the communication side of things, about the integration with Athena? Yeah. Fran, any final thoughts, just, about your experience overall?
Yeah, so I actually, we chose Klara out of looking at a couple of different companies. Weave was one at the time. And we in particular chose Klara because it integrated with the phones, but it also allowed us to keep track of things in a visual way. One of the problems that we've had in past practices is that when someone calls, you don't have a record of exactly what is said on that call. But when you're using Klara, you have a record of what was said. It helps me as the manager, to be able to catch things immediately and jump in if I have to, because people make mistakes, but sometimes those mistakes are taken really badly by a patient. And so you need to intervene quickly, and you actually have proof of what happened. That makes it much easier to start with, I'm sorry, that information is incorrect, or whatever. We also love that Klara will basically transcribe our voicemails. That has been a game changer for us. Nothing is perfect, so there are some things that don't come out completely the same, but you can, as Francesca mentioned, you can go in and choose where you start to listen to that. So usually for me, it's making sure the phone number is correct, callback phone number is correct, or the date of birth is correct, or the spelling of the name is correct. All those details that you normally on a phone call would ask someone to repeat anyway, or you repeat back to them. Although that's our backup, and it's been fantastic for us. And for the most part, I'd just like to say that our patients love it. They like that they can get immediate answers to questions. And they also know that if something gets lost, if it's in somebody else's box and we can't see it in triage, that is one thing that does require a little bit of training for the staff. But if it doesn't get into triage, they know that we answer the same day. And if we don't, they know to reach out again. So our patients have learned that we do get back to them and it's all because of Klara. We wouldn't be able to do that with phone calls. There's no way, just not with the number of patients we have. And we have literally, there are 4 of us on the staff. One's a tech, one's a medical assistant, and then myself and our patient care coordinator. Those are the people who answer the phones. So we're able to maintain that with 3 providers by using Klara.
That's wonderful to hear. Yeah, the centralizing, all of those communication channels into one, and just having that record. Yeah, absolutely, very important. Excellent. Well, I know we're winding down a bit, so if anybody else has any questions, by all means, type those in the chat. Otherwise, I will, maybe 20 minutes in your day back. Hopefully, you're enjoying lunch. Oh, hey, Lynn, nice to see you. Yeah, well, thank you so much for joining, everyone. It's been an absolute pleasure. Allison, I don't know if you have any words to wrap up. Otherwise, I'm happy to.
No, I just want to thank everyone for joining and for your engagement. And thank you to the Klara team for all the wonderful information that you provided. And thank you, Fran, for sharing your experience. It was really helpful to hear about that. And I don't know if anyone else has any other questions for both the Klara team or for Fran, but we have the opportunity to do that now.
Yes, absolutely. Thank you to Fran. She's a wonderful advocate of Athena and Klara, so we very much so appreciate you.
Absolutely. Thanks for the opportunity.
Yeah, thank you.
You all can feel free to reach out to me if you have questions.